Most runners think physical therapy will get them back to running. But most insurance based PT was never designed for runners in the first place. It's designed to just treat the body part, get you back to walking, but not running. And that's exactly why so many runners stay stuck in pain. This video, I'm going to show you why cheaper insurance-based PT often doesn't work and how you can actually get rid of pain and stay running long term without wasting time or money. So I'm Dr. Ray Peralta, a physical therapist and run coach. And over the past 10 years, I've seen how so many patients or runners, that is, get stuck, right? Going to different clinics thinking, oh, I'm just going to get the cheapest option, right? Or I'm just going to use my insurance, right, to try to get help. But the problem is, right, just asking, oh, get the insurance to try and get the cheapest option, price shopping, right? You think you're going to, get pain free. The reality is that you'll just see a PT, maybe they help you with that painful body part or whatever, but then the pain comes back the minute you start running again, right? This boom bust cycle. You think you're saving money, that, oh, I'm still getting pain free. But then the reality is, okay, you feel good. Then you go back to your running, right? You overdo it, increase the speed or the pain, and then the pain comes back, right? And then you have to rest and recover again. I've seen the same cycle play out for folks, runners who are training for like a marathon. Every training cycle, boom, they rest. They go to PT or chiropractor or whatever, some other alternative where they think it's cheaper. They're saving money, and then the pain keeps coming back, and they're just stuck in this boom bust pain cycle, right? And maybe they even try other options. They'll try injections plus PT or some other doctor who's a specialist, and they continue to have pain. They're stuck in a temporary cycle of these temporary fixes, going to different specialists, doctor shopping, using insurance, but they're not fully getting recovered. There's not true, real recovery. And if you want to copy this Google Doc to learn more about running pain-free, I'm sharing inside my free online run group. Click the link in the description. So the truth about insurance-based PT. See, insurance takes the care, right? It tells you how many visits you can have, what the actual treatment restrictions are, right? And the focus usually, just try to get pain relief, just basic function, walk a few blocks, but not really performance. They don't really bridge the gap to performance. They don't really show you how to run pain-free. Oftentimes you get cookie cutter programs, right? You get the same exercise that everyone else is doing. Right? You're typically doing the same leg raises or clamshells. Maybe we'll put an ice pack on you or a hot pack, maybe a little bit of ultrasound, a little light massage, and then boom, you're on your way. You maybe only spend a few minutes with the actual physical therapist, and then you passed off to an aide, right? Oftentimes you'll be here like, it's not really individualized for runners, right? Again, it's usually meant for the everyday person who's sedentary, who just wants to get back to walking a few blocks, and that's it, call it a day, right? Someone who's like working at a desk job, but doesn't really care about running. And so that's what most traditional insurance-based PT, it's really just about basic functions, not really about getting you back to, running, or especially even marathon running for that matter. And the real issue, right, that these insurance-based clinics, they limit your visits. Maybe you get 5 visits, maybe you get 10 visits, maybe you even get more visits, but they're just focusing on the one body part, not really looking at the whole system, not looking at your running form, mechanics. People think that they're getting a deal, and oftentimes you're paying co-pays. So now you're having to travel, commute out to this clinic, pay co-pays. Many people quit. Many types of clinics who use the insurance system often seeing 4 patients an hour. So now you're being cycled, you're being passed off to an aide, usually like whether they're just like a student or something, or someone who not really has the same knowledge as the PT, as a physical therapist. So now you're just left with an aide who just watches you do some exercise on a machine, and then you just go home for the day. And you get minimal one-on-one time with the actual PT. And oftentimes that PT is overburdened because there's been so many clients during the day that they don't really have the time to give you the true one-to-one care that you need, and then just give you a cookie cutter program. Right. So you get low quality supervision. And then many people think, okay, let's say you're even with the PT for like a few months. You think, oh, now I'm pain free. But oftentimes it's just the rest, not actually that the PT got rid of your pain, just that you weren't running. Because, if you rest, most injuries or things do heal within 3 to 6 months. So let's say you're in 3 months. If you're thinking, oh, I'm in PT for 3 months, I'm no longer feeling pain. The minute you start running again, the pain comes back. Because the pain wasn't just about the painful structure, is that you didn't actually build up the low tolerance, your tissue capacity, right? So why do most running injuries happen, right? It's usually because the load exceeds your body's capacity to tolerate the load, your low tolerance, right? Whether the load is in terms of mileage, while you're training for a marathon, or you're training for speed, or trying to improve the speed, or there's certain types of terrain or workouts, whatever, all these running types of stressors increase the load, which then if the body can't handle it, it breaks down, whether it's the knee or some other body part. So another thing that happens is like, oh, you think, oh, your knee's good, and then boom, you get another injury just to couple weeks later, it's just you just get a different injury of the month. That's another thing that also happens as well. Then you just keep going through a cyclic, going to doctor's office, PT, and you might even conclude that running's not for you because you keep getting injured so often. It's usually because you just haven't built up your body's capacity to handle the demands of running. And this is why so many doctors will say, "Oh, running is bad for your knees," or "You're just too old to run because you keep getting injured." The thing is that no one really has shown these runners, even these older runners, on how to build up their capacity, their tissue capacity, their capacity, making sure they're fully recovered. Because your body, if you build up its capacity, you could be well into your 60s and 70s and still be able to run marathons, right? It's often addressing these things that make up your capacity, whether it's sleep, stress, nutrition, your tissue strength, tolerance. All these things add up, right? Because if you just sleep deprived all the time and no one's really helped you address that, then yeah, you're going to keep getting stuck or having some other kind of injury. That's also a big risk factor for injury. But all these things are integrated. And the point I'm trying to make is that most PT clinics, they just focus on the one body part. They don't look at nutrition. They don't look at truly bridging the gap from pain to performance. And then this cheaper versus results mindset. A lot of folks have this like penny pinching mindset, right? And then I asked them, hey, is price the priority or actually getting results, actually, being able to run pain free for longevity? Because a cheap option, sure, again, you might get short-term relief. I'm not saying you can't get some pain relief. But the thing is, long-term, you're going to relapse. You may have another injury. You may have the same injury recur because they never really showed you how to train smartly, how to run in a safer way to actually prevent the injuries. And, what I offer, yes, it's more of a premium option, both a physical therapist and a run coach, but I help people get full recovery and also teach them how to prevent injuries so they can enjoy running well into, their 60s, 70s, and beyond. I was talking to a runner a couple of weeks ago. She spent money on multiple treatments. She's thought, I'm going to do PRP injection. I'm going to do a cortisone injection. I'm going to do HA, hyaluronic acid injection. Pain kept coming back. So she's still in pain. Now, yes, she would rest. She would do PT, she would do chiro, rest, but then, she'd be able to run for, maybe a couple miles, maybe 2 or 3 miles. But then when she started ramping up to train for a marathon, the pain would come back or some other issue would come back. And she would get frustrated. She's like, oh, maybe I just am not built for distance running. I could only just do very short runs, like 2 or 3 miles or something, like 5Ks. But the truth is that she, she was having this limited mindset of just trying to be cheap and she was ended up paying more money just going through all these different things. She had to pay for the PRP, had to pay for the chiro, had to pay for this other PT, right? Yet she was still not able, because all these folks were more generalists, right? If you really want to get back to running pain free, realize that, investing in your health, if it's really important to you, you'll find a way to make it work. And now I think about smartphones. So many people will buy the expensive phones because they value them, right? Maybe they like the features, maybe they're more reliable. They could choose the cheaper option. It could technically does do somewhat like you make a call on the cheaper option. Maybe you can access the internet, but they don't. Many times people will buy things like the iPhone. Like you can see that's let's see, over $1,000 there on the iPhone when you can get like some cheaper option for like a third of the price. But many people will choose that. I've even seen people where they don't have the money are still able to afford these luxury items, right? I'm in New York City. Oftentimes I'll see people in areas of like low income. I'm like, wow, you're saying you can't afford it yet. You're able to afford all these expensive clothes, jewelry, phones, etc. So when people see the value, they invest in a sustainable health. I've even seen people who truly value their health, even though you'd think they wouldn't be able to afford it. Those people who are like, hey, you know what? Yeah, and times are rough, but it's really important to me to be able to run pain free. Right? So if it's important to you, you're gonna make that shift. Right? And I encourage you guys, if you're one of those penny pinchy people, to shift to long-term thinking. Right? Cheap equals only having more time off running, more re-injury, and sure maybe that painful body part might get better with rest or traditional PT, but then some other injury happens because you never fully understood how to run properly to stay injury free. So the true cost is the time, the frustration, repeated treatments that are ineffective. And the real solution is fixing the root cause and building durability. So what happens when a runner gets serious about running pain-free, especially with the runners who work with me? The runners stop bouncing between different providers, right? They get a clear plan tailored to them. They build their strength, mobility, and proper training and return to running pain-free, whether it's marathons or just enjoying the half marathon, and stay consistent without setbacks. So what I do with the athletic runner method that I created is not just look at the one body part, here's the exercise for you, but to help you be pain-free, look at the entire system, a holistic approach, your running form, runner-specific strength mobility, fueling, plus sleep and recovery, because all these things are added, integrated. If you just do one thing and miss the other parts, you still could break down, right? If you're under fueling, you can still get bone stress injuries. If you're not following smart running program, you can still get injured, right? You need all these parts to have a robust system to run pain-free and to be a more athletic runner. It's not about, competing in the Olympics. It's just so you can enjoy running for longevity and being pain-free. So I currently have 2 spots open to work with me privately for one-to-one to help you run pain-free and stay injury-free long-term. If you're curious, there's a link in the description to apply. First come, first serve. So in conclusion, cheap care often leads to expensive problems later. Heck, maybe you keep delaying, you keep pushing through the pain, you keep having the same recurring knee pain, and eventually you end up getting like a knee surgery that could have been avoided, right? Insurance PT is typically not designed for runners, right? If results are more important to you, then you should really consider that versus just trying to, penny pinch and look for the cheapest option when it comes to your health, right? Because this cheap really gets you results. You really want to be a cheapskate when it comes to your health. Longevity in running requires the right strategy, not just more ineffective treatments.